Did you know that 1 in every 10 couples have problems with conception? According to the U.S. Department of Health and Human Services, an article done by Eunice Kennedy, 9% of men and 11% of women experience infertility. Infertility is defined as despite having tried for a year with unprotected sex and time planning, a couple is unable to conceive a child. There are many signs and symptoms of infertility in both men and women. The major signs can be an irregular period in women, painful or heavy periods, pain during sex, changes in sexual desire, testicle pain and swelling in men, and problems maintaining an erection. Although infertility is most commonly found in women, 2/3 of men have problems making sperm in their testes. Amongst other issues that could cause male infertility: abnormal sperm production, undescended testes, genetic defects, health problems such as diabetes, infections such as STDs, and enlarged veins. Some of the treatment options, specifically for men, after they are analyzed and tested, some of their testing procedures include semen analysis. This is where they would have to go into a facility and I guess they're instructed to go in a room and ejaculate into a cup, where then their semen count is analyzed and counted out, and then the doctors will determine from there if low sperm count or no sperm count has anything to do with the couple's infertility issues. Also for men, there is hormone testing, where usually it's done through blood draw. They will draw blood and then they will test the hormones that are found within the blood system. I'm pretty sure that there's testosterone issues, which is the male hormone, that those are things that could probably be fixed. They will also do a testicular biopsy and imaging as well. For treatment, not all fertility can be treated or reversed. For men, their treatment options include lifestyle changes, dieting, alcohol and substance control, medication, surgery, sperm retrieval. And they can also go through a surgery that can reverse sperm blockage. For both couples, there is the option of doing a surrogate. They can do donor sperm or eggs. And then there's also implanting of the embryo in the uterus is another option. Some of the signs and symptoms for women are some of the reasons why women experience infertility is a blocked fallopian tube, which can be reversed with surgery; PID, which is pelvic inflammatory disease; endometriosis, which is a lining. It is a thickening of the lining in the uterus; surgery after ectopic pregnancy, which is a previous pregnancy that was in their fallopian tubes. The baby did not descend all the way down into the uterus to implant it, implanted in their tubes. Physical problems with the uterus, which is scarring; uterine fibroids, which are non-cancerous lumps on the uterine walls; hormonal imbalance; age and certain health conditions. Age in both cases can be a reason for infertility, because as both parties get older, their sperm count decreases, and egg production, as women get closer to menopause, become fewer and far between. So one of the options for women is also fertility drugs. They can do where the sperm is placed inside the uterus around the time of ovulation. Like I said before, there was surrogate. There are many risk factors with this. They risk multiple pregnancies, ovarian hyperstimulation syndrome, bleeding, and infection. Ovarian hyperstimulation problems are swollen and painful with the ovarian tubes. As I stated, not all fertility can be treated and reversed. A lot of doctors prescribe lifestyle changes, hormonal treatments, and many other options. A lot of couples are embarrassed by this topic, which I think it's more common than a lot of people want to believe. So if you're having problems with infertility, please just seek help, and it's okay to talk to your doctor about it.